very sad to announce that even though the storm has not yet hit, we have had 3 deaths related to the preparation of the storm. One in Hanover, one in St. Catherine, and the other in St. Elizabeth. And these are due to persons preparing for the storm, unfortunately, cutting down of trees in particular. In one case, a tree fell on one of the individuals in St. Elizabeth. He was airlifted, and it's a health worker. He was airlifted to the University Hospital and succumbed to his injuries. Another case in Hanover, the same thing. And another case in St. Catherine. In one of the cases, there was an electrocution, as is reported to me, linked to the cutting down of trees. There have been about 13 other injuries linked to preparation, most of which are linked to persons falling off ladders or rooftops trying to prepare for the storm. I just want to use the opportunity to urge Jamaicans, firstly, to express condolences to the family members who have lost loved ones, and the health system will provide support as necessary to those individuals. But to also urge Jamaicans, we understand the need to prepare, but we urge extreme caution in that preparation. If you need help, call for help, but be careful that you protect yourself even in the preparation, because already we're seeing the tragedy of lives lost. So a couple of things that re-update. Firstly, I was late because I was on a conference call with the health ministers of the Caribbean region, chaired by the head of CARICOM, who expressed the desire to support, and I gave them an update, and I want to just publicly thank my colleague ministers of health in the Caribbean who have offered to provide support wherever that is needed, including CARFA and CARICOM health ministers. So I got a little delayed because of that conversation. In terms of the updates, health centers remain closed, as we had announced, but all hospitals remain open and all are prepared. I have done a number of visits over the past 24 hours or more, visiting some of these institutions, having conversations with the staff, and at the Emergency Control Center in New Kingston, headed by Dr. Dawkins Wright, who is here in the audience. We have had several briefs involving the respective regional health authorities and the hospital heads. And from all that I have seen, we are prepared and ready. There's adequate water storage supplies, adequate food both for staff and patient, adequate medical supplies, a logistics infrastructure which involves our own logistics but also coordination with other agencies like the Fire Brigade and others. And I think generally speaking, there's a staff that is ready and waiting. The message to them is firstly to take care of their family members, ensure that their homes are safe, and then commit themselves to ensuring that over the next number of hours they will commit fully to serving the Jamaican people from a healthcare perspective. So that is in place. We are concerned about a few hospitals that are on the coastline. So Noel Homes in Hanover, Black River in particular, in St. Elizabeth because of where the storm will enter the country, and Falmouth, Trelawney. We have evacuation plans for those institutions. So today we started some evacuation efforts out of Black River. Fortunately, we just completed a 12-foot seawall on the coastline between the hospital and the sea, and that is in place, which will provide a buffer and some protection. But based on projections of 13 or more foot waves, we do anticipate a breach of that. So we have moved some of the services out of the hospital further inland and have relocated patients from the ground floor to the second floor, and hope that that will suffice for any surge that will take place. The other institutions have evacuation arrangements and will exercise that as the case may be. Each of those institutions, of course, have generator backup power that will take them hopefully through the period that may be downtime until power is restored. The staffing for the surge capacity are in place. Rosters are in place. Doctors, nurses, biomedical engineers, drivers, and porters, all of those are in place to deal with the possibility. In terms of the challenges around the actual event, which very little can be done between now and early AM, which is when we expect the storm to hit. Outside of the preparation of the institutions, and we urge those home to ensure that they have adequate drinking water, because turbidity can impact quality of water. So to the extent that you can collect your water now while your pipes are still running, please store drinking water. The non-perishable foods, please be mindful of that and secure that to the extent that you have not already done so, and there's an opportunity so to do. We are aware that from a health perspective, post the event, there is the risk of contaminated water, contaminated food. The ministry, part of the discussion I had today with the public health team, we have just about 600 of them. These are the officers who go out into the field and visit, retail outlets, wholesalers, institutions, to ensure that the integrity of our food chain is maintained. They, under the law, have the authority to seize and dispose of foods that they suspect is contaminated, because a major consequence, if we get past the storm, is the ill effects of what happens after, and water and food are critical. So I just want to remind retailers, sellers of food, that they should put whatever is necessary in place to ensure that whatever is perishable is protected, but also to say that the team will be out in the field right after to examine and to ensure that the food supply remains intact, and they do have the law on their side to protect consumer safety. But the system will be ready to deal with that, but food-related diseases are very common after these types of events. In terms of our children, today I visited the Bustamante Hospital for Children. The key to our children is to provide them with psychosocial support during this period. The last major event we have had close to this one is 37 years ago, Hurricane Gilbert. And it is a frightening experience for those who have not experienced this kind of storm, wind and rain and flooding and so on. So we want to encourage our parents or adults or guardians to give our children some extra support, and where they need help, please give them that support. Guide them as it relates to the after event exposure to water. They're always going to be tempted to go outside and play into the puddles of water, which oftentimes may be contaminated because of the runoff. Solid waste will be an issue naturally, because people throw things all over. The water will bring it to the lowest point, and there will be a concentration of pollutants within that particular environment and space. The other issue is the mental health challenge within our society coming out of the trauma related to this. There are many persons who will be anxious, would be uncertain, be scared. We are beefing up our mental health facility. Just to remind you of our helpline, 888 New Life. That's 888-639-5433 and 876-838-4897. We're encouraging persons to use the lines if you need to talk to someone. We have members manning those lines on standby, and will provide whatever support that we can give. There are vulnerable populations in the society that we are mindful of. The older population who are chronically ill, those who require medication for their hypertension, diabetes, other forms of chronic illnesses. The NHF, I've had a meeting with the NHF. They are prepared to provide information and support. They're also prepared to deliver medication once the storm would have passed. And we're putting in place some creative ways to maneuver the obstacles that we would likely encounter after the storm. And what we would ask persons to do is to keep in touch using the One Love helpline, 888 One Love, for the vulnerable populations to be given whatever support they can. The final point I'd raise is the issue of persons volunteering to give support. So in disasters of this kind, because of who we are and the generosity of our diaspora, as well as just general the globe, there's going to be a lot of offers to provide support. It's going to be important for us to ensure that that support is coordinated and that it is properly organized. Now, I know that ODPM and Minister Mackenzie will provide whatever channels of contributions and the management of that process. As it relates to health, we have put in place a mechanism through our charitable foundation and the National Health Fund to ensure that we are able to guide the type of support that may be needed in the immediate aftermath, the logistics of that support in terms of coming in, where it is stored, how it is distributed, because you can end up tripping over yourselves because everybody wants to help and there's no coordination around that help. So I just want to say that those who are offering to support the restoration from health's perspective, we will be happy to guide you and to provide you with the appropriate guidance as it relates to that. I want to close by thanking the healthcare workers. They are not unaccustomed to emergencies and to going beyond the call of duty. They have been very resilient and have really demonstrated their commitment to protecting the country. So I want to just use the opportunity on behalf of the government to thank them and to just ask them to continue on this trajectory and that they have our support in delivering and protecting the Jamaican people. Thank you.